Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a quick video about one of my favorite nutrients. Trying to pick a favorite nutrient, it's kind of like trying to pick your favorite child. You probably can't really do it. But in all seriousness, I want to talk about one of the nutrients that I probably prescribe the most out of any nutrient, and that is magnesium. Magnesium is something that I have prescribed thousands of times, and it's something that can be very helpful in different patient cases. When it comes to magnesium, one of the challenges that we have is that there really is no definitive test to tell us if there are adequate levels of magnesium in a patient's body and their various tissues. You can get a blood level of magnesium, like in the serum, in the fluid part of the cell, or a fluid part of the blood, rather, and that will tell you how much is in the blood. And that value, though, has to be kept within a fairly narrow range. If your level goes too high or too low, there can be some really severe health issues that can transpire. And the long and short of it is that you could have very normal looking levels in the blood, but there might be very low levels in other tissues in the body. There are some other lab tests which are outside of the box of conventional laboratory testing in Canada, at least, but you can get a test done through a private lab, something called a red blood cell minerals panel, and that will tell you how much magnesium is inside of the red blood cell. And that's probably a better marker of tissue levels of magnesium because you know how much is actually inside of a cell, and red blood cells in this case. But my thought there is that, well, red blood cells are quite a lot different than every other cell in the body, in part because they're the only cell in the body without mitochondria to produce their energy. And they're also really different because they live in the blood and they're red blood cells. They are not liver cells or brain cells or lung cells or muscle cells or whatever other cell it happens to be. So as much as some of my mentors do talk about, experience testing red blood cell mineral levels and finding them to be useful measures, it's just something that I haven't really got into and practiced myself to any great degree. And so what I prefer to do is to screen clinically for signs suggesting possible magnesium deficiency. And then if that seems to make sense and the symptoms fit, then doing a therapeutic trial with magnesium and see how it goes and see if the symptoms improve. And so it's a very safe nutrient. They've done studies giving people high dosages of elemental magnesium for prolonged periods, up to 3 months, and no adverse effects were noted. And in clinical practice, as much as there are some patients who do have general flare-up symptoms, especially in my practice where I treat a lot of patients with complex chronic illness, some of my patients who go on higher dose magnesium can have detoxification type reactions, but that's more often in patients who seem to flare easily from just about anything. So it's not too common to see that, but it does happen. Very rarely, patients might find that they feel too tired if they're on certain types of magnesium. So there are some kind of little obscure reactions, but generally the most common side effect, and really the only side effect for most people, is that if they take too much magnesium, they will, or orally at least, they will find that they have loose bowel movements, or if they take way too much, they'll actually have diarrhea, which is no fun. Intravenous magnesium, a little bit of a different story. You can drop a person's blood pressure and things like that, but we're talking about oral magnesium here. So with respect to magnesium, some of the clinical clues that will point me in the direction of possibly working with magnesium would be if a patient said they have a lot of muscle cramping, because you need magnesium to help facilitate muscle relaxation. If a patient was constipated, that might be a clue, because my rationale there is that if the smooth muscle in the bowel is low in magnesium, it's probably not contracting and relaxing as efficiently as possible, and so that can help to rectify that. Magnesium at higher dosages can be used as a non-habit forming, non-stimulating laxative, rather a osmotic laxative, so that's something that can be used to help get the bowels moving just even more directly than making sure that the smooth muscles have adequate levels of magnesium. If patients are feeling anxious or they're having sleep issues, that could be a sign of magnesium deficiency, because magnesium is a crucial factor in the formation of serotonin, which is one of our feel-good neurotransmitters, and therefore it's also a cofactor for the production of melatonin, because we make melatonin from serotonin. It's a byproduct of serotonin, so that can be another clue as well. Sometimes the patients have heart palpitations, or they have a tendency towards a racing heart. Sometimes that can be rectified or improved by working with appropriate dosages of magnesium. And There are some other miscellaneous symptoms as well, but those are some of the main ones that I screen for in my practice. So I use magnesium a lot because a lot of patients have one or more of those symptoms, and it's just such a crucial cofactor for so many different reactions in the body. You need magnesium to help facilitate the breakdown of estrogen. You need it to metabolize excitatory neurotransmitters like dopamine and adrenaline. So if people are feeling really revved up, then they might need magnesium potentially. You need magnesium as a cofactor in making energy on a cellular level. So there's many different things that require magnesium to function properly. There's a book. I'm forgetting the author's name now. I think. Names on the tip of my tongue, can't remember, but it's called something like The Miracle of Magnesium or The Magnesium Miracle. It was written a number of years ago, and it's a really great book, and it really talks about how magnesium really is seemingly miraculous because it's important for so many different systems in the body. So maybe it's not my favorite nutrient because I do like so many of them, and it is hard to choose a favorite because they're all so important, but it's certainly the one that I prescribe the most, and it has the potential to facilitate really quick clinical improvement in some patients. I've had patients, and it's not the rule, it's the exception, but I've had patients where like all of their fibromyalgia pain just gone with magnesium, and that was it. And that's happened a couple of times in my practice out of hundreds and hundreds of patients, maybe over 1,000 now with fibromyalgia diagnosis, and it's hardly ever happens, but it happened a couple of times. Resolving restless leg syndrome happens all the time with magnesium, not always, but oftentimes it resolves it or helps to clear up constipation, can help with some of the other symptoms that I mentioned. So it is really, can help with migraines in some cases. It's just a really fantastic nutrient and certainly really important to be aware of.